get some data where we can use it as a biomarker, but it has potential, obviously, as the technology gets better, then the potential applications can improve. I should turn to the questions that I know. The first question I can't answer is how can I get Miglustat in Canada? Well, Joe Clark is sitting in the back of the room. Joe may be able to help because I don't understand what's called the healthcare system in the US. That's misusing the term system. I think the healthcare department would be better. They actually have a system in Canada, and I'm sure that Canadian colleagues, maybe they could address that tomorrow in the session. I think it would be best to talk. So we'll defer that and talk about a country that's approved the drug. There's another question here which is about physical therapy and asking about should you be doing physical therapy for a girl of 14 who's in a wheelchair. My answer would be yes. Again, we're going to talk about this more tomorrow, but physical therapy is very important. Basically, it comes down to the principle of use it or lose it, all right? It doesn't matter who you are. If you don't move your joints, they'll seize up. If you take a star athlete and you injure their shoulder or immobilize it, it'll end up frozen. And that's a disaster. So it doesn't matter whether you have NPC or anything else. You have to move your body and use it. But it's a more acute problem if you have a progressive neurological disorder. It's going to limit your coordination, it's going to alter the tone of your muscles and have effects on your strength. So my answer would be yes. I think it's very important to have physical therapy. One of the problems people have in the United States is that insurance companies are just a big problem anyway, but one of the problems they have with insurance companies is insurance companies don't understand these diseases. They think that physical therapy is for people who sprained their ankle or something. So you're going to have a plan and it's going to be better in 6 weeks or whatever the time period may be, and then it's going to finish. So I can't tell you how many times I've called insurance companies or written letters to help people with this. This is an ongoing process. This is something you're doing to maintain someone's health and mobility, to maintain the suppleness of their joints. If you don't move a joint, the soft tissues contract and you end up in big trouble. So physical therapy is very important for that reason. There's another question here. It's a very specific question about a child. Maybe I'd be happy to talk to the parent afterwards because I don't think I can answer this with this information. It mentions a 5-year-old boy who's become anxious in unfamiliar settings, wants to go home, gets upset, has some unusual gestures he makes. How can we reassure him? I think I need to know more about that, but the general comment perhaps that might be helpful is we do know that children, there are many reasons children can become anxious, whether they have NPC or not, and unfortunately you need not be restricted to having one disorder. If you happen to have NPC, people can have other things going on. This could be a disease manifestation, but again, we really need more information to answer that question. So I'd be happy to talk to whoever asked that question privately after if they wish. There's another question about treating dystonia in a child, what therapies or medications can help. Physical therapy is important in people with dystonia, as I mentioned before, to keep the joints mobile, supple. But there's specific drug treatment we can use. Dystonia is a manifestation of dysfunction of the basal ganglia, which are the deep nuclei within the brain which modulate voluntary movement and involuntary movement, part of what's called the extrapyramidal system. And dystonia is just a description that refers to the simultaneous contraction of agonists and antagonists. What does that mean in English? Well, if you flex your elbow, the agonist muscle is the biceps and the brachialis. That's flexing it. That contracts. At the same time, the triceps muscle has to relax. If you have dystonia, they don't coordinate, and so they both stiffen at the same time. And so you can't get more movement. So you get these unusual postures, and it's caused by co-contraction of muscles because the basal ganglia are not functioning properly. Well, there are drugs that can help with that. The one that, again, we don't have any double-blind controlled trials, and nobody will pay for it. But at least based on practice, the drug that I would usually use first in someone who hasn't had treatment would be trihexyphenidyl, or Benzhexol. It's got 2 different generic names depending on which country you're in. It's also called Artane, as it's traded in the United States. That's a drug which can actually be very effective. One of the problems is people sometimes don't give enough of it. In children with so-called symptomatic dystonia, which is what you have in NPC, sometimes you need doses of up to 60 or 80 milligrams a day. And if you gave that much to me, I'd be flat on my back. The children can tolerate it, and they often need it. And that's one of the problems we encounter in neurology. People often underdose with medications, and that's particularly the case. These are symptomatic treatment. It may not last forever. There are other drugs we can use. But again, I think it's important to recognise that this is a symptom of disease that can be treated with varying degrees of success. And sometimes there can be remarkable improvement with trihexyphenidyl. There's one question that says, can you recommend anything to help my daughter sleep better? Well, that would depend on why the child's not sleeping well. And there are lots of reasons for that. There are some basic things. Sleep problems are very common in children. And I'm sure you all know that the standard advice that we give. We see lots of teenagers with sleep problems too. And of course, part of the problem there is they've got their iPod stuck in their ear at 120 decibels, so that doesn't help you get off to sleep. It sounds ridiculous, but it's true. So people shouldn't have the television on, they shouldn't be listening to music, they shouldn't be texting their friends. This does not actually help you get to sleep, so you need the right environment. You need not to have too much stimulation before going to bed. You should be exercising within a couple of hours of going to bed. Very basic things. You need the environment correct. But if all those things are taken care of, and someone has a normal level of activity during the day, because if you're not normally active, it's hard to sleep. If those things are taken care of as much as they can be, then the thing I usually recommend is melatonin, which is the hormone that normally induces sleep. Now, you can, again, it hasn't been studied in a double-blinded fashion, but it's actually the first recommendation of the American College of Child and Adolescent Psychiatry now, as a hypnotic, as a medicine to induce sleep in children. Because there are some data about it. It seems to be safe. Again, the problem we find with neurologic disease is people often don't give enough of it. The standard sort of doses for adults are between 1 and 3 milligrams. Sometimes we give 12 to 15 milligrams to children with neurological disorders. And we use this in many disorders apart from NPC. So that's something that can be effective. We can use other drugs if we need them. Part of the trouble with this disease is it affects every part of the brain, including those parts that control sleep. And one of the manifestations of abnormal sleep is cataplexy. Because cataplexy actually represents an intrusion of what's called REM sleep into normal consciousness. You probably heard the terms REM, or rapid eye movement sleep, which is the sleep that occurs mainly in the latter half of the night when you're dreaming. Your body is paralyzed, but your eyes are moving when you're dreaming, as opposed to non-REM sleep. Well, there are certain disorders related to pathology in the upper part of the brainstem where little fragments of REM sleep can intrude at inappropriate times. One of them is narcolepsy. So if you fall asleep while I'm talking, there's probably a normal response, but if you fall asleep excessively, that so-called excessive hypersomnolence, then that's narcolepsy. That's REM sleep, because if you actually put EEG electrodes on someone's head, they're in rapid eye movement sleep. It doesn't take them 90 minutes to get there, they fall into it instantly. It's one of the ways you diagnose. So that's one fragment. Another fragment, remember I mentioned when you are dreaming, your body's paralyzed, but your eyes are moving. Cataplexy is a sudden paralysis of the body. It's a fragment of REM sleep that's intruding. So it's called gelastic cataplexy in the big C because of the humorous stimulus, that's the gelastic part. Something the child thinks is funny, you may not be able to recognize it, will cause them to lose tone. It can be as subtle as a little head nod, and maybe weak at the knees, or in dramatic cases, they collapse to the ground. I'm sure many people are nodding their heads, you've seen this. And it's not a laughing matter, because it can happen hundreds of times a day. Children can hurt themselves. That's something that's very treatable. Usually, not always, but usually responds to the tricyclic drugs quite well. Well, the other sleep disturbance that occurs in NPC is sleep inversion. And that occurs when people tend to be awake at night and sleep during the day. And that, of course, is a huge, huge problem for families, because you've got to earn a living, you've got to earn it during the day, you need to get some sleep at night. So it's not only the child or the adult with the disorder who's disrupted, but the whole family. And so helping re-establish that sleep cycle using the non-drug approaches plus the drugs, I think is terribly important. Okay. I probably talked too much there, so I'll hand over to Marie now.
Well, first, Marie.
We have to stop, it's lunchtime.
Okay.
But the doctors will be able
We can answer that tomorrow, but I'd like to speak personally to a person who was asking, I was told I do not have a mutation but a variant. What does that mean? I'm happy to talk privately with the family. Okay, and then this is a complex question, we keep it for tomorrow.